If you're pregnant and feeling down, this one's for you. Depression during pregnancy is a real thing, and it's more common than you think. Around 20% of women get what's called antenatal depression, and that's when you feel depressed during your pregnancy. It's different from the baby blues, which is feeling low right after giving birth. In this video, we're going to talk about feeling down during pregnancy and practical tips on how to manage those emotions without feeling guilty or broken, so that they don't exacerbate into something even more. From treatment options to lifestyle shifts and finding support that actually helps, we're covering what works, what's safe, and what to do when you're just not okay. But first, who am I? Hi, I'm Liz, a registered nurse and kinesiologist focusing on maternal wellness. On this channel, I talk about all things pregnancy, postpartum, birth, and baby care. So hit that subscribe button for more videos and subscribe to my weekly newsletter where I send you tips and tricks on these topics straight to your inbox. It will also be linked down below. Let's get started. First off, here are some symptoms to look out for, basically alarm bells used to spot that something may be off. The first one is persistent sadness, feeling down or tearful for most of the day, nearly every day. A loss of interest, not enjoying things you used to love. Sleep problems, trouble sleeping or sleeping more than usual. Low energy, feeling tired all of the time. Feelings of worthlessness or guilt about baby, about yourself. Trouble concentrating, finding it hard to focus on making decisions. Dark thoughts. If you have thoughts about harming yourself or others, seek help immediately. If you have a hotline, call that, or even the hospital emergency line like 911. Keep in mind, some of these symptoms like tiredness or sleep changes and trouble concentrating can happen in normal pregnancy. The key is to watch for if these feelings are very strong, very persistent, and you have some of the other symptoms mentioned as well. So, what can you do about it? The first thing is make lifestyle shifts that support your mental health. Realistic shifts in your daily routine. Some examples are making exercise a daily habit. So taking short walks, you don't have to go lift weights at the gym or anything, even if it's just walking to your mailbox. Prioritizing sleep. So instead of late night doom scrolling, we've all been there, just try to have a nighttime routine. Drink plenty of water and eat nutritious meals. Prioritize hanging out with friends. Start doing something like prenatal yoga or just some breathing exercises for a couple minutes a day. Engage in activities that you like. For example, reading, art classes, being out in nature, it could be anything. These all might feel like small things, but they create a foundation of healing. You might also look at decreasing stress in your life, so distancing yourself from negative people or asking your doctor to go on maternity leave early. Next is finding a support system. So finding people that you can talk to about your pregnancy as well as your fears and worries so you don't feel so alone going through it. Whether it's your partner, your mom, a trusted friend, and hey, if your current circle doesn't feel safe or supportive, permission granted to find a new one. You could also find local and online support groups. There are tons of Facebook groups where moms connect and ask each other questions and just connect with other pregnant women who get it. Now, let's talk therapy. Talking to a therapist can sound intimidating at first, but if you can barely get out of bed or brush your hair some days, this is when this becomes necessary. Cognitive behavioral therapy and interpersonal therapy are fancy sounding terms for talk therapy. They're designed to help with the guilt, fears, negative self-talk, and the whole what if I'm not enough thoughts rolling around in your head. They basically help you restructure your thoughts and help you see things in a more positive manner. Finally, there's also medication. And here's the truth. Some people need medication, and it can make an absolute world of a difference. Sometimes it really is just that the brain chemistry is off and no amount of self-care rituals are enough. Medications are usually paired with therapy and can be very helpful when battling depressive symptoms. Some medications like SSRIs are considered safe during pregnancy under the supervision of a healthcare provider. Of course, this is not a one-size-fits-all, and your doctor will weigh the risks and benefits together. So you really do need to speak to your doctor about it, but it's not something that you should be ashamed or intimidated of. There's no gold medal for suffering in silence. So, to recap, try and minimize stress and prioritize self-care in your daily routine. Lifestyle shifts can help and the small changes add up. A support system is essential. Find your circle and the people that are supportive of you. Therapy works. There is no shame in talking to a professional about these things. And medication Medication can be taken safely if needed. Talk to your doctor or healthcare provider about that. You deserve a team that sees all of you and not just your bump, so don't be afraid to advocate for your mental health. If you remember one thing, let it be this. You don't have to choose between being a good mom and taking care of yourself. Managing depression is taking care of your baby because it starts with you. If this video helped you in any way, hit that like button and don't forget to subscribe to the channel. Grab my newsletter down below. It's packed with tips and tricks meant to support pregnant women and new moms going through all kinds of things in their life. Thank you so much for watching, and I'll see you in the next one.